doing their own training. You know, they don't have a personal trainer, and maybe they're doing some high-intensity workouts, or guys like me just out raking leaves. You know, you can injure yourself, and then you got to go to the doctor, but then it's kind of like over the internet and all of that. So we've got joining us right now SLUCare orthopedic surgeon Dr. Randall Otto with suggestions on how not to hurt yourself. Good morning, doctor.
Hello. Can you hear me?
I can hear you perfectly. Say, Doc, what are some of the injuries that people are most getting in contact with you about these days?
You know, the biggest issue that I see now is that a lot of patients are starting to do virtual or home exercises.
Mm-hmm. That's what we're hearing.
Are you getting feedback on there?
That's fine. We understand. And they're doing these CrossFit things and also these high-intensity workouts as well, correct?
Correct. Right. And so a lot of people are trying to get into these things. It's a period of a pandemic. People are stuck at home. They're trying to get out and do more exercise. And they're doing a lot of this by looking at videos and at looking at things online, but they may not have the proper technique to be able to do it.
I think one of the most important things that people often don't do is warming up.
Correct. Right. I think it's very important and vital that you have to really warm up and you have to stretch and get nice and loose before you do a lot of these activities.
Yeah, the shoulders, that's one area that I know are injured. That area is injured quite often. What are some of the more common injuries, and how do we avoid those?
Yeah, the most common injuries that we see with these type of workouts are going to be related to the bicep anchor. So your bicep has two different muscle heads, and one of those attaches deep into the shoulder. Mm-hmm. The other is the rotator cuff. Your rotator cuff are muscles that basically help to hold the ball stable into the socket. So a lot of these injuries are going to be more frequent and more common as we start to do activities with overhead pushes or presses. So people who do a lot of overhead military type presses, push-ups, bench press, things like that. And if you don't work on building the strength of your shoulder girdle up, then you can be more prone to injuries with these.
Yeah, I had
the most important thing is...
I was going to say, I had the shoulder instability one time, which was just brutal.
Right, right. And the shoulder is inherently just an unstable joint, so you really require those muscles to help to hold it nice and stable, and it really starts with your shoulder blade. So people should focus more on shoulder blade muscles and pulling type exercises more so than doing a lot of pushing exercises. So I think if you can get a strong, stable shoulder blade, then it makes it a lot easier to start doing some of those pressing exercises.
And isn't much of this because of repetitive motion? Do you suggest maybe doing fewer reps?
Well, initially you want to do lighter weights and then slowly build up the number of repetitions. I think one of the issues that people start going and they want to get all the results right away, and it's something you really have to build up. It's like training for a marathon. You can't run 20 miles your first day.
Mm-hmm. And then as folks get older, sometimes they slip and fall and they stick that hand out, and that leads to all kinds of injuries too. You can have a dislocation.
Right, right. That or rotator cuff tears or broken bones or fractures, all of those can lead to it.
So overall, Doc, what do you prescribe? What is this in a nutshell?
So the biggest thing is you want to warm up. You really want to stretch out first. Then you want to really focus on proper form and posture and sitting up straight, drawing your shoulder blades back. Pulling exercises are going to be better than pushing initially. And the other thing is you want to keep your hands inside your peripheral vision. Once your hands start to leave outside your peripheral vision, that can aggravate it. And then you want to start doing some rotation exercises because that'll build up the strength of the rotator cuff and then ultimately stretch to cool down afterwards.
Some good advice. Doctor, thank you so much. That's Dr. Randall Otto, and we thank you for joining us right now. He's with SLUCare EDU Health Watch, and you can check him out. We'll have a link on our website at fox2now.com.